right, so here we're going to talk about the hypertensive drugs, right? Which drugs do you use for hypertension? So, as you can see, there's a whole bunch of them. Some of them are central acting, meaning that they act in the brain. You have the ones that attack adrenergic receptors. You have the direct vasodilators, calcium channel blockers, ACE inhibitors, angiotensin receptor blockers. Remember, ACE is the enzyme that converts angiotensin 1 to angiotensin 2. ACE is right here. So it's the angiotensin converting enzyme, right? ACE. And you have the angiotensin receptor blockers, and then you have the loop diuretics. So when we talk about central acting drugs, we are talking about conidine, which is basically an alpha 2 agonist. Remember, alpha 2 are receptors that block norepinephrine release. So that's what that is, norepinephrine release. They block that. And then you also have alpha methyl dopa. Alpha methyl dopa is a receptor that that goes in place of dopa. Remember that your inside your cell you have dopamine, and dopamine, and it leads to norepinephrine. So you have alpha methyl dopa that goes in place of dopa. And remember, you get dopa. From dopa, you get dopamine. This is a normal pathway. So I can maybe put it in a different color. Okay, this is a normal pathway. Dopa makes dopamine and then norepinephrine. So alpha methyl dopa takes place of that, and basically it blocks the formation of norepinephrine. So there are two different mechanisms, but that's what that is. Remember that all the direct acting drugs, they decrease sympathetic stimulation, decrease heart rate, decrease stroke volume, decrease systolic blood pressure, decrease the tone in the veins, they decrease. So if there's if the veins have a lot of blood in it, then not enough blood is going back to the heart, so they decrease end stage volume, and they decrease the peripheral resistance, and obviously you don't have a lot of sympathetic tone to the juxtaglomerulus, so you don't have aldosterone. They all keep the water in. All of the central acting drugs, remember, they cause water salt retention, because the kidney GFR is less, so the fluid passing through is less, so more time to reabsorb. Okay, and then you have adrenergic receptors. So this one was a little bit confusing for me at first, but remember, you have two kinds of receptors, alpha and beta. So then you can have different kinds of drugs. You can have selective ones, and then you have the drugs that are not selective. So for the drugs that, remember, beta one, beta one only is on the heart, right? So you have alpha 1, which are going to affect both the veins and the arteries. Then you have beta blockers. So alpha 1 selective are going to be prazosin, tyrosine, and doxazocin. And then you have alpha 1 and alpha 2 non-selective, so that's going to be phenoxylbenzamine, also phentylamine. And then you have, of course, the beta 1 blockers that are the LOLs. So that's going to be atenolol and metoprolol. Beta 1 and beta 2 non-selectives are going to be propranolol. And then you have some mixed drugs like labetalol, and then carvedilol. So they decrease the heart rate as well as dilate veins and arteries. That's my symbol for veins and arteries. So the alpha 1 and beta 1 blockers are a little bit dangerous because the alpha 1 blocker means that you have no alpha 1 block. If you block the alpha 1, then you know that you kind of dilate the arteries and the veins. And the alpha 2 blocker means that you are pretty much inhibiting you're inhibiting your norepinephrine feedback, right? So that means that you have increased norepinephrine. Of course, that increased norepinephrine can no longer act on the arteries and veins because they're all blocked by alpha 1, but it will but your beta 1 is good to go, so it's going to increase the heart rate on beta 1 receptors, which is kind of a dangerous thing. I mean, you may not want that. So so this is pretty much covering. Remember that beta 1 receptor, so also remember that beta 1 receptors are also found on the kidney. So basically, when you have beta 1 blocker, not only do you decrease the heart rate, you also decrease the renin-angiotensin system. So pretty much dilating all the veins, dilating all the arteries, decreasing contractility. So in the next part of the video, we're going to go and talk about the direct vasodilators and the other ones, okay? So stay tuned for the next video.